Cumulative risks of stent migration and gastrointestinal bleeding in patients with lumen-apposing metal stents. Introduction. Since the introduction of lumen-apposing metal stents, LAMS, in 2012, the applications and uses of these devices have steadily grown. LAMS have been employed in a wide variety of procedures, including the treatment of luminal gastrointestinal GI strictures for cystogastrostomy and direct endoscopic necrosectomy for gallbladder drainage and for gastrojejunostomy. The adverse events after routine endoscopic procedures are widely known and include hemorrhage, perforation, sedation-related adverse events, and several less common problems. They may occur intraprocedurally or in the subsequent hours to days. In contrast to the currently available data on adverse events, i.e. migration, stent dysfunction, bleeding, related to placement of LAMS remains anecdotal and incompletely reported. Furthermore, LAMS-related adverse events may appear weeks to months after the procedure, therefore requiring endoscopists to remain vigilant in the care and monitoring of patients long after the procedure is performed. Given the multitude of indications necessitating LAMS placement, there is substantial variation in the LAMS dwell time following placement. For example, the median dwell time in pancreatic fluid collections, PFCs, is usually less than or equal to 2 months. Studies evaluating enteroanastomoses as well as endoscopic ultrasound, EUS-guided gallbladder and bile duct drainage demonstrate a longer median dwell time of 3 to 6 months. As a result of these issues, future reporting of adverse events after LAMS placement might benefit from cumulative risk assessment, which allows an estimation of the risks after different lengths of clinical follow-up. There is also a paucity of data with regard to the risk factors associated with LAMS-related GI bleeding and migration. Most published studies have focused on the technical and clinical outcomes, and the relatively small number of adverse events does not allow further analysis. Our study aimed to assess the cumulative risks of stent migration and LAMS-related GI bleeding, and to evaluate the risk factors for these events in a large patient cohort. Background and study aims. Delayed gastrointestinal, GI, bleeding, and stent migration are known adverse events which may occur following placement of lumen-apposing metal stents, LAMS. Patients and methods. All consecutive patients who underwent LAMS placement between May 2011 and June 2017 at a single tertiary medical center were included. Demographics and procedural details were prospectively collected. Post-procedure follow-up and outcome measures were retrospectively collected. The cumulative risks of migration and LAMS-related GI bleeding were estimated using the life table method. Risk predictors were assessed using Cox proportional hazards models. Results. The authors analyzed 250 patients, 64.8% men, median age 71.6. Median follow-up was 78.5 days, IQR 31 to 246.5 days. 34 stent migrations, 13.6%, occurred, 5 symptomatic. On multivariable analysis, associations with migration included nasocystic drains, hazard ratio 6.5, 95% confidence interval 2.2 to 19.3, pancreatic fluid collections, PFCs, HR 4.2, 95% CI 1.8 to 10.1, and double pigtail stents, HR 2.4, 95% CI 1.2 to 4.9. Migration risk at 12 months was 25.5%, 95% CI 17.9% to 35.7%, and was higher for PFCs 48.9%, range 33.4% to 66.9%, than other indications, 8.4%, range 4.9% to 17.5%, p less than 0.001. LAMS placed for longer durations, i.e. enteral anastomoses, biliary and gallbladder drainage, presented an 8.4% cumulative risk at 2 years. There were 13 LAMS-related GI hemorrhages, 5.2%, 2 of them fatal, presenting a median of 3 days, IQR 1 to 9 days, after deployment. The cumulative risk of bleeding at 12 months was 6.9%, 3.6% to 12.7%. Conclusions. LAMS migration occurs in 1 out of 7 cases and is most common when treating PFCs. Bleeding related to LAMS placement occurs much less commonly but can be life-threatening.